All right, thank you, Alana. In our coronavirus coverage tonight, the state of Utah reporting another record-breaking high number of new COVID cases, more than 7,200 cases today alone.
ABC4's Courtney Johns has more on what health officials are saying about the surge and the impact the Omicron variant is having on our health system. She's live in studio with the details tonight. Courtney.
Yeah, Glenn, before today, the highest daily case count in Utah was on December 30th with just over 4,700 people testing positive. Looking at today, we're at 2,500 more today. But if we're strictly looking at positive cases, the better indicator is that 7-day average, which is also high. The good news is there are several reports that suggest Omicron, which officials believe is making up a majority of these cases, appears to be more mild. The bad news, it's spreading so much faster than what we've seen with other variants.
Even with a milder disease, if you have a very large portion of the population infected, we're going to still have a lot of hospitalizations. And as I think many people know, our hospitals have been overwhelmed for 4 months.
Okay, so here is what state epidemiologist Dr. Leisha Nolan is talking about. ICU availability. There's a difference between available beds and having enough employees to take care of the people in the beds. Now, the Utah Department of Health says anything over 85% capacity, that's 85% of ICU beds full, overwhelms the hospital system. That's the red line that you see right there. The green line is the percentage of all people, not just people with COVID, currently in those ICU beds. Now, we know there's a lot of data out there, and depending on who you talk to, you'll get a different answer on what these numbers give the best info on. But Dr. Nolan says both case and hospitalization trends are helpful, but for very different reasons.
I think the case count gives us a trend, but the hospital tells us what the real impact in our society is.
Right now, just under 500 people are in the hospital with COVID-19. And another piece of data we hear a lot about is positivity rate. Right now, it's at about 23% in the state of Utah, but that data can also be deceiving because of all those at-home test kits people are taking are not included in this data, which is why the health department encourages people to do that traditional PCR test when possible. Right back to you.